Endymed's 3 deep fractional skin resurfacing treatments improve the appearance of various skin textural problems. Scientific evidence gathered by physicians around the world shows that the effects of 3 deep FSR treatments improves the appearance of wrinkles, enlarged pores, acne scars, and overall texture and vitality of the skin. The fractional skin resurfacing application may be used for the treatment of generally sun-exposed body areas such as the face, neck, décolleté, and hands. Before treatment, wash and dry the treated areas to remove lotion and makeup. Clean the skin with alcohol and apply the anesthetic cream such as EMLA for 30 to 40 minutes. We recommend covering the area treated with EMLA with plastic wrap. Before starting the treatment, clean the EMLA residues gently with 70% alcohol. Do not over-dry the skin. The fractional skin resurfacing treatment tip is intended for single use. Hold the FSR tip with 2 fingers from both sides and insert it onto the skin resurfacing handpiece until it clicks into place. When the menu screen opens, select the FSR application. From the treatment menu, select the desired treatment area. We suggest beginning with the cheeks. The system will automatically set the treatment default parameters. You may change the parameters, power and pulse duration, according to your needs. Perform a treatment test spot on the border of the intended treatment area, preferably non-visible, in order to assess the optimal parameters for the patient. With the fingers of your free hand, gently stretch the skin around the treatment spot. Position the FSR handpiece on the skin. Push and hold the trigger on the handpiece. An audible clicking signal and illuminating LED indicates RF emission on. Release the trigger only after you hear the sound that indicates that the pulse was completed. Evaluate the test spot at least 5 minutes after the pulse was delivered. If mild to moderate redness and edema is observed, or the patient reports manageable discomfort, continue on to the treatment with the same settings. In case of severe edema or excessive discomfort, decrease the pulse width by 10 milliseconds and 1 watt. If the patient doesn't feel the treatment at all and you observe no erythema or edema, increase the pulse width or power by 10 milliseconds and 1 watt. Once the treatment parameters have been adjusted, you can perform FSR treatments using the FSR template, which assists in easy positioning of the handpiece and uniform coverage of the treatment area. Place the template on the intended treatment area and hold it tightly. Use a light, oil-free base white eyeshadow and a small sponge to spread the makeup through the template holes, creating a uniform matrix grid on the skin. Position one corner of the upper edge of the FSR tip on one of the outside dots of the grid, so the surface of the tip covers the first area to be treated. Deliver a pulse by pressing the trigger. Lift the FSR handpiece and position the same tip corner on the next grid dot so that the upper edge of the tip now covers the next area. Deliver a pulse. Continue treatment throughout the grid. When prompted by the system, use soft gauze moistened with 70% isopropyl alcohol to clean the treatment tip. Next, dry the tip well with dry gauze. Acknowledge the system message and then continue on with the treatment from the last location you treated on the grid. Decrease the treatment parameters when treating bony areas such as the forehead, jawline, or temples. Continue this procedure for full and uniform coverage of treatment area. For enhanced clinical effect, it is possible to cover the area with additional passes of pulses. Do not stack pulses. Following the treatment, mild to moderate edema or erythema will appear for a few hours. Clean the face gently and apply soothing cream to soothe the redness and heat sensation. After the treatment, patients should pay attention to the following guidelines. Do not use makeup on the day of the treatment and keep the face completely clean. Avoid using peeling products or exfoliates. Minimize sun exposure following the treatment, and in any case of sun exposure, apply a high-potency sunscreen for up to a month after treatment. Men should avoid shaving for a week. Apart from these guidelines, patients can immediately resume all their normal activities. Following the treatment guidelines in the tutorial will ensure optimal results and customer satisfaction.